Good morning, everyone, and thank the organizers for inviting me to share with you this morning on the total workplace safety and health, a holistic approach towards workplace safety and health. Let me share with you firstly my own personal experience in this area of workplace safety and health. The first time I heard about occupational medicine I was a medical student. And at that time, my professor tells me that occupational medicine or occupational health deals with the two-way relationship between work and health. How work affects health and how health affects work. So I was very excited, the old professor telling us, giving me this whole concept. And then, as I attended the course, attended the module, all the time the talk was about how work affects health. Completely, right? During my undergraduate training, it was about how work affects health. So I thought maybe because I'm only an undergraduate, how health affects work is a postgraduate topic, right? So I stupidly signed up to do a master's in occupational medicine, hoping to learn about how health affects work. Went to my master's classes for 1 year. Again, it was about how work affects health. So a lot of emphasis on occupational diseases. I can still remember this particular example of a patient that I saw. It was his father who came to see us, right? The father came very, very breathless. And because I was interested in occupational health, I asked a very simple question: what is your occupation? What do you think his occupation is? This was the workplace. His occupation was to prepare tombstones, right? So he was preparing and polishing tombstones and so forth all the years of his life. And essentially, by the time he came to see me, his lungs were so badly damaged by the silica dust that he has inhaled and ending up with silicosis. There was nothing I could do, as a doctor. Because essentially, even if I take him away from work, by that time, all the silica dust is already in the lungs, it will continue on. He's just literally waiting to die. But going to the workplace, I saw his son. This was the son, right? This was the son doing exactly the same work. He has been exposed for 10 years, doing exactly the way the father has taught him, right? So there was a lot of emphasis on how do you prevent the son from ending up just like the father, okay? And that's good, that's nice, that's occupational medicine. How does the workplace influence the health? And of course, a lot of sessions on workplace safety, unsafe work practices, and so forth. So we had a lot of all this emphasis. But again, nothing on how does health influence our work. Now, maybe for a lot of us, it's quite commonsensical. How does health affect work? It's common sense, right? Why do you need to really study about it? Very commonsensical. This obese worker who is a window cleaner, obviously he cannot work from heights, right? Obviously, I can't expect him to climb up a ladder. The ladder may give way, right? So it's very commonsensical. So a lot of issues in terms of how health affects work is very commonsensical. So much so that we kind of forget about it, right? And we put a lot of emphasis on how work affects health, but we forget about what is directly staring in our face, how health affects work. For me, trained as a medical doctor, we also begin to realize that sometimes certain medication that we prescribe to our patients actually put them at higher risk, right, for safety issues, for occupational diseases. Take, for example, if you have mild hypertension, we like to give this drug called Lasix. One problem with this drug, Lasix, and in fact that's how it works and control your high blood pressure, is it makes you go to the toilet. Not big business, small business. Right? So you pass a lot of urine. Okay? Can you imagine someone who has to work in, say, from heights, you have to climb up. Every time he wants to go to the toilet, climb down. Right? And then after that, climb up again, and then climb down. Well, the inconvenience is one thing, but with passing out a lot of urine, you get easily dehydrated. You end up actually getting very giddy. Okay? So again, issues like this. If I prescribe Lasix, the worker won't be smiling like this. Right? It's very inconvenient, and it's actually very, very dangerous. And then, a lot of times, a lot of so-called work-related diseases like musculoskeletal problems, yes, a big driving factor, a major factor is the workplace factor. How you design your workplace, how you work at the workplace. But there are a lot of non-workplace factors that actually would also contribute to some of these work-related diseases. So musculoskeletal problems in the workplace, for example, obesity is one big risk factor, right? Apart from workplace factors. So I think the first point I want to get across is that we need to ask ourselves, instead of asking, are there workplace factors that influence health alone, we need to also ask, are there so-called health factors that could have contributed to our safety issues, that could have contributed to the onset of occupational diseases? And the answer to that is definitely yes. Right? This is one of the questions in your assessment, I hope. So the answer is yes. Right? So there are going to be issues in terms of non-workplace factors that are going to contribute to the onset of safety issues, to the onset of occupational diseases. I think the next question we need to ask ourselves is that, are there actually any diseases that a person has that could cause a worker to be more susceptible to the onset of earlier complications from that disease? And let me share with you a particular disease called diabetes. Right? This disease is called type 2 diabetes. Type 2 diabetes is an adult onset kind of diabetes. Most of you know about diabetes being a condition due to high blood sugar, or a condition characterized by high blood sugar. You know, the Chinese name for type 2 diabetes is basically you have high blood sugar, right? But what's the big deal about high blood sugar? You know, isn't a high blood sugar good? The problem is that the sugar should not be in the blood. The sugar should be inside the cells, in particular your muscle cells. And here, what you have is the sugar is circulating around. Having high blood sugar essentially damage your blood vessels. So one of the things is that it will damage small blood vessels. And because most of us are standing up, and there are a lot of small blood vessels actually in our limbs, in our feet, you know, in our hands, you get a lot of problems with the legs. So again, when I was a young medical doctor, before I took on my master's in occupational medicine, I was posted to this ward called the orthopedics ward in Singapore General Hospital. Essentially, this ward looks after people with bone problems, right? And there was this person who came in. All he complained of is, my leg is swollen, I can't quite walk. Right? My leg is swollen, I can't quite walk. Any pain? No pain. Right? You feel anything? No, I don't feel anything. And the reason he doesn't feel anything or he don't get any pain is because all these small blood vessels supply the nerves to the feet. And the nerves are basically dead. Right? Now, being someone interested in occupational medicine, I asked him another question. What do you work as? And he says, oh, well, I'm working more as an odd job kind of person. I do construction work, deal with this and deal with that and so forth. So I said, do you have any recent accident or anything injured your foot? No, nothing at all, completely nothing. So you start to examine this fella. And the first thing, of course, you look at the foot is swollen. I look under the foot, right? He took off his slippers, I looked under the foot. On the sole of his feet was a nail stuck inside there. All right? Somehow he has walked on a nail. He didn't even realize it because he can't feel a damn thing. Right? It got infected and essentially it got swollen because of that. Right? So he had a nail. I don't know for how long he has been walking around with that nail because he walked into my clinic, right, with a nail. I can't even imagine, what do? I take a pliers to take out the nail? What do I do? Right? Essentially, we couldn't save the foot because it got so badly infected, right? And this is very, very common. You get people ending up with the foot needing an amputation, right, in a diabetic. And we basically have to amputate his foot. And a lot of people with diabetes, after you amputated it, the stump doesn't heal well, or they subsequently get infected again, you amputate again. Right? So you start off with amputation at the ankle, then after that you go higher up below the knee, and then after that at the knee, and then above the knee, and then above the knee I don't know what else to do already. Right? Essentially, if the infection continues, they end up dying from the infection. Right? So having an existing condition, the workplace may actually cause more rapid increase in terms of the rate of complications. And diabetes is no fun. Right? Diabetes, you end up with eye problems, you basically grow blind, you end up with kidney problems. Right? So imagine if this is a diabetic worker who is exposed to, say, cadmium, for example, which affects the kidneys, exposed to inorganic lead, for example, which affects the kidneys, right? It will increase the risk in terms of chronic renal failure, right? And then it will also affect in terms of your large vessels. That's where you end up with ischemic heart disease or heart attack, you end up with stroke. So having an existing disease can increase our risk to safety issues, occupational diseases issue, but conversely, having existing disease, the workplace can also cause us to have higher rate of complications. Right? And I think the next question we need to also ask is that, are there diseases that will cause significant loss in terms of workplace productivity? And again, common sense tells us, of course it does, right? Of course it does. But sometimes it's very difficult to quantify what is it, especially, say, at the population level. So that's where, for us, working in public health, we try to quantify that. And again, going back to the example of diabetes. You may have seen this kind of picture in the newspaper, in Straits Times. Right? It basically describes the population of Singapore by different age group. And the graph on one side shows men, the other side shows women. And we say that this is called a population pyramid, and it has been described that our population pyramid is changing in its shape. But in 2010, we estimated there are about 350,000 diabetics in Singapore. Right? So out of the entire population, about 11.3% are diabetics. Worse still, half of them don't even know that they were diabetics. It was during the survey that when we did it, we tested them. They said, we never knew we were diabetic. From now on, they are diabetics. Right? So they have been diabetics around for a long, long time, walking around, not knowing that they were diabetics. Right? So we have 11.3%. 11.3% doesn't sound frightening sometimes, 21 years old. And then you age, and you reach 60 years old. What it means is everyone today who is 21 years old, out of every 3 of them, 1 of them will become a diabetic. Right? So 1 in 3 chance that you will become a diabetic in your lifetime. Now that's a hell of a lot. Right? That risk is very, very high. The gray area in the center of the pyramid, population pyramid, show the number of people who are diabetic. The black area is what we estimated the total number of people in the working population who are diabetic. 150,000 in the working population are diabetic. Right? And we estimated what is the cost to Singapore. The cost to Singapore from this 150,000 diabetic only, just the 150,000 diabetic, is 1 billion Singapore dollars in 2010. Right? So in other words, just from this 150,000 diabetics in the working population, it costs Singapore $1 billion. Right? Most of the time in the past, employers will not worry about diabetes because diabetes is an old man disease. You end up with people retiring or leaving the workforce, then they get diabetes. It's no longer the employer problem, right? It is the nation's problem. But we are increasingly seeing more and more diabetics occurring at a younger age group. Now it is possible to find a diabetic who is 20 years old. When I was a medical student, the youngest diabetic is probably about 40 years old. Now, 20 years old. Right? So we are going to get more and more diabetics in the working population. Not only that, our retirement age is going to get extended. It's going to be a problem in the workplace. Right? The number of diabetics is going to be a problem in the workplace. Then we did some projection. 2020, even more. We will have 500,000 diabetics in Singapore. And I told our Minister for Health, whatever you do today, whatever we do today in Singapore will not change this figure. We are too late. We are doomed to have 500,000 diabetics in Singapore in 2010. I hope I can be proven wrong, but I'm very sure we will have 500,000 diabetics in Singapore by 2020. Because to prevent diabetes takes many, many years, many, many decades. Right? So we can't change this figure. 2020, we will have 500,000 diabetics. 2040, 2050, we will have 1 million diabetics. Now that number we can change. We need to do something today, we need to do something now to change that number, to make sure that we don't hit 1 million. Right? So that is possible. Now what is driving diabetes? The biggest driver is actually obesity. But they said, hey, we Asians, we Singaporeans look very nice, what? Yeah? We are not obese. Yeah? We look around, we are not obese. Right? If we walk out of MBS and we see someone obese, tourist, foreigner. Right? Most likely tourist, most likely foreigner, not our local person. Right? And it's right, you're true. It's easy to try and measure percentage body fat. So we did a study to measure percentage body fat in our population, and we compare, firstly, the amount of percentage body fat in a Caucasian and that of an Asian. And the conclusion is this. If I have a Caucasian of BMI 30, he's called obese, that value of percentage body fat in a Chinese, his BMI is 27.5. In other words, 27.5 in me is the same as a Caucasian of BMI 30, the amount of fat, right? Worse still, for an Indian, is 25.5. So the percentage body fat in an Indian of 25.5 is the same as the amount of body fat in a Caucasian who is 30, right? So if we use 27.5 as a cutoff point, it doesn't look very nice now. Right? We got quite a lot of people who are obese, but they don't look obese. Right? We're kidding ourselves. We think we look good, actually not very good. Right? Most recent data, even worse. Almost a quarter of our population have BMI of above 27.5, and yet we look good. Right? Basically, we are obese. Right? But as all Asians, or in particular all Chinese, we hide it very well. Right? My surgeon friend says, if he has two patients, a Caucasian patient with a BMI of 30 and an Asian patient with a BMI of 27.5, anytime he would prefer to cut the Asian, in terms of operating into the stomach, into the abdomen, right? The reason, for Caucasian, a lot of work, right? Not worth the effort, right? He has to cut through layers and layers and layers of fat before he reaches the abdominal cavity, right? Because all the fat is in the abdominal wall, hidden in the abdominal wall, right? I shall not spoil your lunch, but you know what I mean, right? For an Asian, very easy, one stroke, the abdomen open up, right? And what it sees inside is fat surrounding all the organs. So for an Asian, all our fat is intra-abdominal. For a Caucasian, the fat is in the abdominal wall. It's the intra-abdominal fat that is the dangerous one, right? So essentially, obesity is a big problem with us. So a few points I think that is important for us is, firstly, unhealthy workers are more susceptible to workplace accidents and occupational diseases. Unhealthy workers can have earlier onset of complications due to workplace exposure. Unhealthy workers can cause significant loss in productivity and increase the cost of doing businesses. So I think those are facts that it's quite commonsensical. I think we accept that, but we tend to forget about that. So what do we need to do? I think we need to come back to this two-way relationship between work and health. So we must continue to protect our workers. So we must continue to work in terms of workplace safety. We must continue to work in terms of prevention of occupational diseases. But we must also promote the health and well-being of our working population in order to reduce the impact of all these chronic diseases. Right? We have to expand our scope to be able to do that. And so we need a more holistic and integrated approach. Not just looking at safety, but looking at safety, health, and well-being. That's where we like to introduce this concept of total workplace safety and health. Right now, at all levels, government level, at management level, the worker on the ground level, the whole thing is fragmented. The healthcare delivery system and the health system for workplace is completely fragmented. We need to do something to bring it together, to see the whole thing as a holistic approach. And that's what this total workplace safety and health aims to do, to look at safety issues, health issues, well-being issues as one. So the way we define total workplace safety and health is that it's a comprehensive and integrated approach to manage workplace safety and health. So firstly, it's talking about maintaining a safe and healthy working environment for all employees. Second thing is that we're going to take a risk approach, a risk assessment, risk management approach in a proactive and integrated way with participation at all levels and in particular from the employees. So we want to protect and prioritize what kind of programs are needed. But the idea is that you think outside of just safety programs. You think of health programs. You think of well-being programs, right? And then finally, of course, is how do we build capacity in terms of the whole country? Say, for example, among yourself as well, how do we build the capacity to be able to cope with that? How do you expand your capabilities to beyond just safety, but to cover health and well-being? We need to do that. We need to build towards that kind of culture, build towards that kind of capabilities. The way we're approaching it will be through various strategies, building capabilities and competency, building awareness, building understanding, getting interagency collaboration. So, for example, Ministry of Health and Ministry of Manpower working together, Workplace Safety and Health Council, Health Promotion Board working together, working with industry, working with unions, and taking a more promotional and a phased approach. So we'll be moving towards this direction. So what we're calling for is a mindset shift, to have a different way of thinking. Right now, most workers and most employers think more in terms of work safely from 9 to 5, right? What we want is now work safely and healthily for a whole lifetime, for an entire lifetime, right? To work safely, to work healthily for an entire lifetime. We're not talking about just on a day-to-day basis. So just to summarize, number one, we need to pay attention to this whole issue of huge onslaught of chronic diseases. We hear our politicians always saying, yes, we're getting older. Please don't remind me. But unfortunately, the reality is that with that, we are going to get more and more chronic diseases. I showed you diabetes. There are actually others, right? Hypertension is a big issue. Hypertension prevalence is even higher than diabetes, right? So just add hypertension and diabetes alone. That will actually bankrupt a lot of companies, and that will actually bankrupt the economy, right? So it's not a small thing. So we realize that we are going to be faced with that. We also have to realize that it will impact on workplace safety. It will impact on occupational diseases. It's no longer just your workplace causing a disease. Now it's the disease that you have going to increase your workplace accidents, going to increase your occupational diseases. Right? And of course, it's going to impact on the well-being of the workers and the families. And it's going to impact the cost of doing business in Singapore and ultimately the economy of the country. So total workplace safety and health is just an attempt to try and integrate safety, health, and well-being. Right? So it's just our attempt to try and integrate. It's almost like we have no choice. Faced with this, we have no choice but to integrate. But it can be just a concept, an approach, and everybody says, okay, I'm happy with it, yes, and nothing happens. Right? just a concept and an approach, I think, will not work. What is more important is, I think, all of us, every single one on the ground, to have a change in mindset and then increase in terms of our own competencies. So total workplace safety and health require all WSH personnel to upgrade, to expand, right, on the coverage that we used to be doing, to move out of our comfort zone, to be able to see that, hey, health issue is not just in the hands of the doctors. As a doctor, I tell you, we are at a loss of how to deal with this. Right? We only know how to deal with it when you get sick. So if you get sick, I'm happy. Right? Because more money for me. Right? Right? But to prevent, I am really at a loss. Doctors are really at a loss of what to do. It actually have to deal with a lot of people on the ground, a lot of other professionals on the ground moving this whole thing forward. Right? So actually, I'm representing the doctors coming to you to appeal, right, that we need your help in order to tackle this. Right? Because even if we have more patients, we can't cope. Honestly, we can't cope. Okay? Our hospitals cannot cope. Full stop. We are building new hospitals, more hospitals. What are we doing? Like I told our minister, we suddenly realized that we have a basin with water running into it. And the number of hospitals that we have to handle all these diseases or chronic diseases that is coming in is overflowing. It's too small. The basin is too small. Let's build more hospitals. What are you doing? I'm converting my basin into a bathtub. Right? Then, okay, bigger, safer, better. Right? But the tap is still running. It's just a question of time before that basin is going to overflow. What are you going to do next? Change in a Ritz-Carlton bathtub, is it? Right? We cannot afford it. Okay? So essentially, I'm appealing to you from the medical profession point of view that we need your help to work together, a complete change of mindset, a complete change in working practices, and therefore a complete change in terms of your capabilities and your competencies. Right? Health issues are not difficult. It's very commonsensical. It's just the doctors trying to make it more complicated so we earn more money. Right? For you, it's actually not impossible to pick up a lot of the health issues, a lot of the well-being issues. Right? And we're willing to come down and help to build that capacity because we are faced with a huge problem. We are faced with a huge, huge problem, and it's not a question of it will only hit us years later. It's hitting us now. Thank you.